Yeah, well, since that's her presenting complaint, it looked like from your case, you know, I would sort of, in looking at the story as it unfolds, I would kind of first be thinking, okay, what are all the things that I now know about this person that could relate to fatigue? You know, it certainly could relate to some nuanced issue around thyroid management, but also I wanted to talk a little bit about her ferritin levels, but so low ferritin, the vitamin D deficiency, perhaps the mold exposure, perhaps gluten antibodies. She's presumably eating the bread that she's baking. And what else? Oh, even the medications. I had looked up sort of Singulair and Allegra, and those can go both ways, but certainly fatigue is one of them. So I think there's, and I might have forgotten one, but there's multiple potential causes of her fatigue, and I think it's a matter of prioritizing just so that I can sort of check off, okay, we're done with that one, we've corrected her vitamin D deficiency. So that would be what I would be thinking. What are the things in her story that could be the causes of her fatigue? And of course, it can be more than one thing.
So on that note, though, how, you know, she's in your office,
Yeah.
you've got this differential in your head.
Yeah.
So how do you prioritize?
Yeah. Well, I would look to see, is there some place where some of her symptoms are, like there's more dots to any one of those than others. And the ones where there is, I think, more dots is actually the low ferritin. Fatigue, hair thinning, insomnia. Those are all potentially related to her fatigue. And not very many, I think, people really appreciate this, and it wasn't something that I appreciated until all that long ago, which is women's ferritin levels. I think normal is sort of 20 to 150, but a ferritin below 45 or 50, right around there, can be related to fatigue. A ferritin below 75 can be related to hair thinning, and a ferritin below about 45 or 50 can be related to insomnia. In fact, there was a study on women and fatigue and lower ferritin levels, and they gave them ferritin for 12 weeks, and 50% of them, their fatigue improved. So there's a lot of dots there for me around the low ferritin.
Yeah, and ferritin, I mean, also is required for the utilization of the active thyroid hormone across the membrane of each and every cell to attach to the nuclear receptor. And so you have low ferritin, you have less usage, so almost like a thyroid hormone resistance if there's a low ferritin level, so it goes in there as well.
And by the way, this is low ferritin in the presence of normal hemoglobin.
Right.
So the CBC is not enough when exploring fatigue and hair thinning and insomnia. We got to order the ferritin too, and this is in the normal range, but it's still below this threshold of 45-50 for women.
And I think that's a great point as well for thyroid, because you're thinking about her thyroid levels being normal and a lot of her lab values being normal, and I think, you know, it's a point that we have to remember that we can't treat lab values, we have to treat people, and that many different symptoms are sub-laboratory in perspective.